Hi, I'm Dr. Vaughan. I'm here with Michael, and Michael is going to give you a little bit of information and a testimonial about what he's been working with it. So hi, Michael, how are you?
Hi, I'm doing well. Thank you, Dr. Vaughn.
So Michael, tell me when you started seeing me, how long you've been working with us, and then what you were coming in for and what you were struggling with.
Okay. So yeah, I've been seeing you for the last few months, approximately 3. I've been struggling with initially the reason I came in was because of the fact that had been diagnosed with irritable bowel syndrome in the past. I knew it was a result of a specific bacteria called candida, and it also had symptoms of leaky gut. Brain fog was another side effect, so anyways, that's what prompted me to come see you and to seek out a resolution to these issues.
Good. And so have you noticed, and what have you noticed a change in?
Well, first and foremost, I've noticed a significant decrease in the amount of times I'm having to use the restroom per day. I've noticed a decrease in my weight, a pretty good amount. In fact, just in the last 2 months, I've dropped about 15 pounds. So it is a pretty good, significant amount. Brain fog is clearing up a little bit, but that's just a work in progress. But those are the two main noticeable differences since I've started treatment with Dr. Vaughn.
Good. And then, so Michael, do you remember the different tests? I know we did a lot of specialty testing. Do you remember the test and what we found?
Yeah, absolutely. So we did do the stool sample, which confirmed the candida and some other bacteria as well. We did do a heavy metals test, which would confirm that I did in fact have different types of metals in my body. There was also the lab test, the blood work, which confirmed different. I think I was even at pre-diabetic. Even had some higher levels on cholesterol, that sort of thing.
Yeah.
And then there was a fourth one. I'm trying to recall what it was.
The food sensitivities.
The food sensitivities. That's right. And it did confirm some foods like sugars as an example. Things that I didn't suspect that I would have had any type of an allergy to, like apples and chickpeas. But it definitely revealed types of foods I should be laying off.
Yeah, good job. And so by doing all that, you're noticing an improvement in the energy, and the IBS symptoms are going away, and all that. So what would you say to anyone that's thinking about joining or starting the program or being seen? Maybe they're questioning, hey, can you really resolve the symptoms this quickly? And does this really work? Or anything that you would suggest or recommend to anyone thinking about beginning?
Yeah, definitely. I would recommend you to anybody, I mean, who's dealing with any types of these issues that I've listed, that I've dealt with, or even just other, it could be something completely different, but I feel like you have solutions to a lot of the problems that conventional medicine doesn't necessarily always have answers to. With elimination diets as an example, supplementation, that sort of thing, definitely can help you. It's a lot better than I think just going the traditional route, where modern medicine may have only a certain way of doing things, where it's not necessarily holistically the best option.
Good job. Yes, I agree. Thank you so much for that.
You're welcome.
Anything else you'd like to add, or?
Yeah, I would just highly recommend your services to anybody that's out there that's looking for some alternative treatment to issues they may be having.
All right. Thank you so much, Michael.
You're welcome.